Artis,
Here.
Annie,
Here.
Bill,
Here.
Jessica.
Here.
Kyle,
Here.
Em,
Here.
Pete,
Here.
Roger.
Here.
Ronald.
Here.
All right, full house, full board. Cool. With that, I guess the first item on the agenda is the approval of the agenda. For any modifications, or is there a motion to accept it as provided?
Is the discussion of, I've had 4 emails in the last 24 hours about a letter that you wrote to a school district. I don't know much more about it. Will we be discussing that? Okay, that's fine.
I'll make a motion to accept the agenda as presented.
Second.
Okay, it's been moved and seconded to accept the agenda as provided with the admission on health officers report. All those in favor say aye.
Hi.
Opposed?
I just didn't get a chance to say one thing, but anyway, just want to say as far as the bylaws, I'm thinking with all of the letters that we got from the citizens looking at it, I'm thinking maybe that should be, instead of voting on it today, maybe we should look into it more closely and vote on another day. It's too late. It's already been a motion to accept it, but I don't know if that could be added later, but I think it should be a consideration. There's a lot of concerns.
Well,
Anyway.
we'll proceed. That's provided. All right, first item, real item is the citizen comment. We did receive a lot of written public comment. Does everybody have a chance to review those?
Very quickly.
Some of them came in very late. So, okay, we'll move. Let's start with the people in the hallway first, and then we'll move to remote callers.
Good morning.
Good morning.
I'm Clarice Ryan. I'm from Big Fork. And I became aware of your meeting, and these are critical times that we're living in, with healthcare being one of the most significant things that have taken over. The decisions that we're making now will be felt worldwide. It's a worldwide issue, especially with this. I know you're not here just to talk about COVID, but I'm relating to that and the communication that is necessary. It's brand new. It's a brand new thing with consequences unknown. We're in new territory, and policies are being made, and the policies that are made need to take into consideration the extent to which it will impact government, as we know government, and how we conduct our policy making and so forth, and also the government and communication and education and so forth. The policies cannot disrupt our normal flow to that extent that we may even destroy our economy. Our economy depends upon stability, and mandating of mandating of closing of businesses and so forth is a detriment to this and a handicap, and we have to do everything we can. Professionally, we're in a very professional field of technical training that is necessary for those doctors and nurses and so forth in the field. And but they have their information obtained from accreditation of sources of where they were coming from and so forth. But they also benefit from input from the public, and that's where you folks come in. And we must protect the lines of communication and honor what you see in the field. That we're in uncharted waters, and we need to be aware of what is going on in the field, good and bad, in order to reach those professionals at the top levels. We can't really expect them to get all the information just from patients coming in. But we have to figure this into the structure, organization, operation of how we facilitate the public input. And it needs to be going to the training specialist who keeps in contact with the other officials at top levels of our government. We need to have that communication open to people like you who represent the public. That is my feelings of the importance of COVID as only an example of why we need professionalism at your level too, representing the public. Do you have any questions as to my opinions? I know your time is limited. I have a copy of your schedule and you have a lot to cover. So I thank you very much for your attention and your consideration.
Thank you, Mrs. Bryant. Yes, just for the record, that was Clarice Ryan.
And she sent us an email that covered a lot of other.
For a long time.
I think she's in her nineties, isn't she? She's amazing.
Never familiar how the system works, but I had a few questions I sent in yesterday. And I'm not,
Can you state your name and address for the record, please?
my name is Teresa Farr. My address is 124 Branchford Lane, Columbia Falls. I noticed I got my Zoom link after I had left home. I thought last time I came 6 months ago, I was able to speak, so. I feel disappointed I don't get to hear discussion because I'm trying, my sincere desire is to really understand what's going on. But here are the questions I asked. So what is the current number of COVID hospitalizations that are vaccinated to unvaccinated? The reason I ask is that the first of the Delta variant constantly on the radio, constantly was reported on the beacon. So I have a beacon where I track my information because I want to be aware. And several weeks ago, that area just quit. So I was curious, are we seeing a bigger uptick in vaccinated? Because when it first started, a lot of people hadn't been vaccinated. And I was curious, as the vaccination has gone up, has that changed in the percentage? Is that being tracked? Does that question make sense? Because at first it was most of the hospitalizations were unvaccinated people. For several weeks, it hasn't mentioned a number. So I was curious what percentage is vaccinated as opposed to unvaccinated, because there being an increase.
You know, you get to provide public comment. This isn't an exchange session. It's just if you want to provide comments to the board, but if you have questions, you could submit a written
I did.
request into the health department.
Yesterday, I submitted these same questions that I have here.
I see, but that wouldn't give them time to, adequate time to respond. So I'm sure Mr. Russell.
So the fact that I submitted them, will someone respond to me in the future? Because what would I public comment on if I'm not able to attend the meetings, if I'm unable to be as informed as I would like?
Well, public comment generally pertains to specific items on the agenda or even not on the agenda, but that you want to and express an opinion on, and not just simply ask questions, because we're here to hear comments, you know, but we're not here to have a forum for questions and answers.
Like if I don't attend the meetings, it's hard for me to understand the discussions and have the background to be educated on what's being talked about.
We do have minutes of all of our meetings, and I guess they're typically on electronically, but I see nothing's on today. So are we having technical difficulties? Or?
We had that one. I can set up the other one.
Just those screens are black.
I just have a few more questions. Can I read them and not have an answer to them?
Pardon me?
I'd like to read my questions, and then if there's no answer to them, it will just take, there's just a few.
Okay, we allow about 3 minutes for comments. So.
Okay, I'll make it quick. Okay, I just have been following the COVID stuff, and a lot of things I just see, it's not per se a blame on anyone. I just can't always figure it out. So I used to talk about, and it was reported in Daily Internet quite a while ago, that 81% of the COVID deaths were comorbidity, people that were most likely going to die. And I wonder, I haven't heard much about that, and so I'm curious what the comorbidity rate is. If it's being tracked, is there any way to know the numbers of only COVID deaths where people died of only COVID? Just to give more accurate information, because if someone's definitely ill with cancer, and of course they get COVID, then it gives a better perspective, right? Because if 80% of 200, you feel like your risk is a lot less. And so I wish that could be reported. I wish there was a way to find numbers that reflect, I don't know, give a better understanding of the real risk instead of just constant numbers without a background yet. And then in the Daily Internet on the 28th, reported that this year we had our first case of flu. Last year, we reported that we had no cases of flu in the entire Montana. And I'm curious how that's possible. I've read different articles, whether the Associated Press or whenever I see it. I mean, I would read it in the news, and I still cannot find 2 years later how the flu has just disappeared. So again, I'm not questioning anyone. I'm just curious how that's happened. I follow the numbers. It seems like they go up, they go down, regardless of restrictions, mask wearing, super spreader events. It doesn't seem to affect it if it's going down. And there's just a lot of unanswered questions. And I truly do wish, so if I want, I can just email people here and they'll answer my questions. Is that the case?
Yeah.
Or is there anyone in particular I should direct these questions to?
You would just direct them to the health officer, Joe Russell.
Okay.
And then he'll either respond or assign them to someone depending upon the appropriateness of the question. So we thank you for your comments.
I hope my questions were appropriate. A lot of times I'm not a doctor. I mean, I just pay attention, so I hope my questions are appropriate. Thank you.
So now I guess we can start with.
The first one is David Ingram.
Can you hear me?
Yes.
Good afternoon, members of the Health Board. My name's Dave Ingram. I live at 607 Sylvan Court in Kalispell. I just wanted to make a few comments on today's agenda. I feel that it would not be appropriate for the board to support the Greater Valley Health Center in its grant pursuit while it is enacting vaccine mandates in violation of the state law. While my guess is because they are receiving federal funding, they are subjected to the unconstitutional mandates and want to be in compliance. This is always the way the federal government overreaches into state law, by they either bribing us or holding us hostage with our own tax dollars. Please make a stand for our citizens. I also support the commissioners and other elected officials' ability to appoint the members of the board by the various entities mentioned in the document. But I think a more detailed description of the composition of the board and the assurance of some representation by county residents outside the city limits is included. I also have a concern regarding the term public health subject matter expert. While I support the elected officials' broad latitude in selecting their representatives as they are ultimately answerable to the citizens, I think further detail regarding this description seems appropriate, as we have seen the federal government abuse this category to justify, I think, unconstitutional actions. I thank you for your time.
Thank you.
Thank you, Mr. Ingram.
Thank you.
The next one is Connie Chevelle Gomez. Ani, if you're on, can you please unmute yourself? The next one is Jessica Kirkendall. Jessica?
Hello, can you hear me?
Yes.
Okay. Hi, I'm Jessica Kirkendall, a Flathead Valley resident and concerned parent. I network with many parents throughout all 20 local school districts in Flathead. I'm here to speak about a few items on the agenda, as well as a current update on our local schools. The oversight of the health officer is high on my ideas here. One thing is I'm seeing that the procedure, the health board bylaws may be altered or amended to reduce the oversight of a health officer instead of tightening it. We've had a big issue in the local public schools this year between September through now, quarantine of healthy individuals and families being put out of work and school for 2 weeks based on vaccination status mostly. Most of the, I've sent you most of the documents from the various health directives we've seen coming from our health officer to the various local school districts, including Smith Valley, West Valley, and Whitefish. All of the different districts over time are getting different, let's say, guidance as well as quarantine protocols. And a lot of them include information based on medical status. Vaccinated take one path and unvaccinated take a different path in pretty much most all of the orders we've seen coming from the health officer. So the oversight of the health officer has been a concern on my mind for a while. And I see that this is bringing it into, I believe he'll be reporting to the commissioners. And I was wondering if he's reporting to the commissioners, how will parents and families have access to voicing their concerns without, or should it be to the health board? It's a little messy right now where we don't really understand if the health directives and quarantine and isolation protocols are going through the health board for approval or the commissioners for approval, who have various duties in our community. And so the oversight and supervision of the whole health officer policy seems not monitored that well at all right now. And then moving forward, it seems like it might have less chance of being monitored. So that's a very big concern I have. As well, I see a new Whitefish specific seat being added to the board. We have Whitefish residents on the board actually already too. To add another one seems quite political with a town that's so small. The city boundaries are the only people that can even vote for the city council. And so in Flathead County, most people, many locals live 1 to 10 to 20 miles outside the county, the city limits. And I see also a line being omitted where several, I believe 5 of the board seats used to be committed to outlying outside of city ordinance, city municipality areas. In addition, let's see, Smith Valley basketball team, I wanted to mention that they were put on quarantine this week. Multiple of the team members were sent out of sports as well as out of school based on vaccination status. That's the newest health order out this week. The West Valley policy, we had an issue with that last month, but that was the one where children were being contact traced that were healthy and being forced out of school. And that was the health officer operating directly with the superintendent of that school district. We're seeing a lot of that. I know Superintendent Hill is going directly with the health officer to the commissioners to request full-time contact tracers for schools, which oddly, when I look at all of the data of the quarantines as well as the contact tracing in a school of a little bit over 6,000, like District 5, I believe it's like 12 or 14 cases in quarantines total as of this week. And that's been a pretty consistent trend. It hasn't been extremely high as expected, or as the media, we should say, portrayed, because a lot of the 19 out of 20 local school districts were able to let their children have, healthy choices, and parental rights were honored, and mask choice has gone on, and it's actually going pretty successfully. Unfortunately, Whitefish did decide to mask their K through 6th graders, and they said that was until October when the vaccine was available. And now here we are in November, no talk about the little ones. We have 5-year-olds that are masked in Whitefish for who knows how long. And there was documentation from the health officer regarding that to support that policy, but it doesn't seem like there's any follow-up about that policy. It seems like that would be it seems like looking at, the 5-year-olds and 8-year-olds that haven't been able to see a smile all year, that would be a really important thing in our valley, particularly knowing that 0 children and teens in our state have died of COVID. We are starting to see, major health issues now, but we don't think that will be for another time. The vaccination rollout, myocarditis, heart inflammation, strokes, very big concerns throughout many countries is being pulled off the market for youngsters. We see that, I think I'll leave it at that for now, and I appreciate your time and attention to these matters. I'll be in touch in the future, and if you have any questions regarding any of this or need more specific information regarding any local school district, I'm happy to reach out to parents in that district as well as school board trustees and gather policies and information. There's so many different ways it's flowing right now that I'd be interested in having a discussion about that if anyone's interested. And I feel like it's really important for our families to get back to normal life. We know that children are really suffering. We know that the only epidemic that we've had among children in this valley, as far as fatalities, is the suicides. It's a very big concern. As parents, we have to wonder what measures can be taken to alleviate these kind of issues that we're seeing among the high schoolers. So if you have any questions in the future, I'd be happy to have a discussion about it. I love to support healthy families as well as parental rights in Montana. And I thank you for your time and service on this board. Thank you very much.
Thank you, Mrs. Birkendall.
Next person is Kathy Jones. Kathy, if you're on, could you please unmute yourself? Next person is Bill Metzler. And the last one is Heidi Rodell. Heidi, could you please unmute yourself? I guess.
All right, thank you for the public comment. Appreciate your efforts, Janelle, coordinating that. We'll move on to the review and approval of the minutes from the October 21 board meeting. Is there any revisions, modifications, edifications to the minutes?
If none, so moved.
Seconded.
It's been moved and seconded to accept the meetings as provided in our packet. All those in favor say aye.
Aye.
Any opposed? Thank you. Okay, the next action item is the Greater Valley Health Center letter of support. Joe, would you like to give us a rundown on that?
Sure. So, thanks, Roger. Greater Valley separated from us a while.
May 31st.
They were given an interim grant to get through to the new grant cycle. So we're starting into the new calendar, year, new grant cycle that starts. And they requested a letter of support from us. I wrote this a couple weeks ago, and I personally, as you can see, I think it's for Roger and myself to sign. Roger's the board chair and he is the health officer. I think it's pretty self-explanatory, and I clearly believe that if you look at the population that the Greater Valley Health Center serves, we need to support them, whether they're not the part of public health, formal public health system. So we feel that it should be a board action to direct Roger to sign it. I could probably sign it on my own, but I would just assume you direct me to sign it also. I'm not trying to.
So just to kind of, if I may, Chair, Mr. Chair,
Oh, certainly.
just to add on to that, you know, as I look at the comments that were brought forward, I just want to make sure that people understand that this is not something new. This is money that has come to Flathead County for years through, and it's just a pass-through to our clinic. So now that they're on their own, they don't, you know, we don't ask for it, they do. So it's not new money, it's continuing money to keep the operation going. And I want to make sure people understand that, because I think they were a little confused, thinking it was new money.
You are the fiscal agent.
Yes.
That's the relationship that is required by the federal government. To have a fiscal agent.
Well, we're not involved at all.
Well, you are still collecting money for the,
No, we're not.
well,
No,
no,
completely out of it.
We're just we're literally.
no, I understand, but I'm on the finance committee, and there's an accounts receivable from the county that is contractually agreed to, that you'll continue to collect money and then eventually turn it over.
That has an expiration date.
Right. It's the end of this.
Right.
And it's a very normal agreement. It has not changed other than the magnitude. Some of it's now coming direct, some of it's coming through the county, because the federal government hasn't changed their accounts payable system, we'll call it. And it will continue until the last check is eventually delivered, and then you turn it over to the health center.
Right, but there was an expiration on that.
Well, it's the end of this month.
This grant is their first grant. This is the larger, their larger grant.
Is there anything, if I may, is there anything to the claim that we see that they're not following the law and that they're mandating vaccinations?
Well, remember, there is some HRSA guidance out there, CMS guidance that states anyone who is certain entities that receive federal dollars, Medicare, Medicaid, will have to vaccinate their staff.
So they're following the federal law.
I don't know, I just had this conversation with others.
Yeah.
I'm not sure that their entity falls within the need to do that. The health department, even though we receive Medicaid dollars through vaccinations, we're not an entity that is required to comply with that. So some entities, some medical entities have to comply and others don't. We don't. But I'm pretty sure because of the services they provide, they will have to. That's not up to us.
No, that's the answer I expected. There's nothing unusual with what's going on. If there are federal laws, they have to comply with it. I don't know. I've not had a chance to ask. She's no longer she's now the CEO. Her title has changed, so I'll walk next door and ask her. But I think what's going on now is perfectly appropriate. You gave a good explanation. I think I used a more technical term here, the fiscal agent. It'll go on until the separation is complete. The bulk of the money, it's about $800,000, is supposed to transfer this weekend. But we expect, on the 30th. But we expect there'll be checks that will follow, because all of the federal agencies, like Medicare and Medicaid, that pay for services, have not changed their accounts payable system. And as those checks are received, they'll be turned over as they would have been in the normal course of business. So I don't find there's anything wrong with that. And until proven otherwise, I reject the claims that they're not following the law.
Dr. Butcher.
Yeah, I just wanted to say that even though it's not new money, I think the philosophical grounds on which these citizens are making these statements still holds. You know, we have to pay taxes for all kinds of things that we don't believe in. And this is something that the Flathead residents, by and large, they don't agree with mandating. Now, I think, we don't know if they actually are. I mean, Joe is saying he doesn't know that they're actually following the mandate. We don't know that. So that's not settled. I know that physicians' offices that are independent, that don't work as staff positions for the hospital, even though they collect Medicare and Medicaid dollars, they are not under that rule. So I don't think we should be so sure. It may or may not be true. But the citizens that are objecting to this money, whether it's new or not, I think their points are very valid. And if I were to say no to this, it would be based on that.
Mr. Chair, can I ask a question? Joe, can you explain what does the HRSA grant provide for our community?
Well, I couldn't tell you the exact amount. I could when we were at EPI.
I mean, services.
But the services that are provided literally, they make up the dollars that otherwise cannot be afforded by a patient in the health center. And that's based on income, your poverty level. If you're 100% poverty, basically you might have a slight copay. But the bottom line is this is funding that would make the clinic whole, that they otherwise would never collect the money because it's a sliding fee schedule. They bill all those services that people can afford, but there's 10% of our population that's 100% poverty or even higher. But you have to realize they can't afford the services, and that money that comes in provides dental, medical, behavioral health services, and that's what the money is for.
And what would our community look like without that HRSA grant?
Well, most of the medical care providers would understand one thing. They would have to pay for or provide those services without any remuneration, which they used to before we had a health center grant. It's just the facts that we all supported it because we all took care of those patients. And the health center literally comes in with that federal grant and provides that level of support necessary for a medical facility to continue to provide that level of service.
Basically, what it does is it provides a safety net for our citizens out there that just can't afford to go to the doctor or for many reasons. Maybe can't afford their insulin. Maybe there's several things out there. This provides a safety net to our community that needs that. And I support the safety net for the community because without it, a lot of our people would be in a lot higher straits out there. So I think it's been a good thing for our community. I support the clinic going forward. I think it's better under its own umbrella rather than the counties. And so I think they need money to continue to help our community. So I support this also.
I think that's a really succinct and well put description of what it's for. So thank you very much. I totally agree with you. And it's a money that they've gotten before every year. We're just offering a letter of support. Simply. So
May I make three comments? Three quick
Sure.
comments. One is that with Medicaid expansion, almost everybody and their brother has Medicaid, so I mean, these people probably are covered. Anyway, and initially this clinic, they touted themselves as being free enterprise, now they're just taking more and more government money. So that's kind of the way of the world, I get that. The other thing is in terms of, good things that they're doing outside of other things that maybe people don't agree with. And the same thing could be said of Planned Parenthood, for those of us that are adamantly against abortion. They do pap smears, breast exams, they do all kinds of good things. That doesn't mean we would support, everything that they're doing. So just those 3 points. So I'm opposed.
thank you.
And I'm in support of the letter and the idea. I think that when we move for the separation to make the county not the fiscal agent for this, we all made a commitment by passing an MOU, but also a lease with this entity, that this was our community health partner. I think that this is a letter of support that goes in nature of that MOU and that lease that we have, because it is still our health partner. We have already done that cleanup over the summer to do the separation. But I'm supportive of this letter because I think that, again, we have a MOU and a lease with this entity. We want them to be successful. So this is how we're moving forward with it.
Thank you, Kyle. All right, with that,
We need a motion.
yes, we need a motion.
So moved.
Second. Okay, it's been moved by Bill and seconded by Dr. Haber to forward a recommendation letter, support letter on for the grant application. Could we have a roll call vote, please, Janelle?
Artist,
Yes.
Annie,
No.
Bill,
Yes.
Jessica,
Yes.
Kyle,
Yes.
Pam,
Yes.
Pete,
Yes.
Roger,
Yes.
Ronald.
Yes.
Okay, it's recommendation passes, or the motion passes. We'll forward this letter along. Thank you. Okay, the next item on our agenda is the cooperative agreement between the Department of Health and Human Services and the Flathead County Board of Health. It's an action item. Mr. Russell, can you fill us in?
Yes, Roger, this, when I came on, this must have just slipped through the cracks. This is something that we usually bring to the Board of Health sometime in February, March of the beginning of the year. We're just closing out this year when it comes to this cooperative agreement. This cooperative agreement is the agreement we have between the state health department and our health department to provide certain food and consumer related services and be reimbursed for our activities based on the amount of activity we do. Succinctly, it's something that we need to do to be reimbursed. Our staff is doing a great job getting to the numbers that we need to. By the end of the calendar year, they've got their targets on the ones that they're a little low on. But no, this is something we should sign this early in the year.
Will we be signing it again in 2 months?
Pretty much. I won't have to say anything else.
So this is like that food rating or restaurant rating that is published in the paper.
No, it has nothing to do with it. It's literally, in Montana, all of the restaurants pay a state legislative level fee that's set by them. We receive 90% of that back based on our activity. So it has nothing to do with any of that. It's literally just reimbursement for services rendered, and all of the other stuff is board policy.
Sounds like it's more housekeeping.
Very housekeeping.
So with that, is there a motion or any further discussion to regarding the agreement? Not, I'd like to have a motion to either proceed or not proceed.
I'll make a motion to have Joe sign the cooperative agreement between the two departments.
It should be one.
Oh, Roger. Oh, okay.
On this one, it should go. Must be.
Roger, you signed my agreement. I'll second that motion.
Okay, it's been moved and seconded to have the agreement with the Department of Health. Janelle, we should have a roll call.
Artist,
Yes.
Annie,
Yes.
Bill,
Yes.
Jessica,
Yes.
Kyle,
Yes.
Pam,
Yes.
Pete,
Yes.
Roger,
Yes.
Ronald.
Yes.
All right, unanimously move forward with that. The next item is the memorandum for DEQ and the variance request. Regarding the variance request, this is an action item also. Joe?
This was actually brought to the Environmental Health Committee. We discussed this. This may be a little difficult to describe, but I'll do my best. When an engineer designs a plan and puts their stamp, they're literally there, they have a stamp, they stamp a set of plans that these will be put in and they will function based on regulation, based on good engineering practices. When they stamp that, there's an obligation on the back end for additional work. certification that the system went in, put in correctly, and the submission of as-built, if anything has been changed, as-built drawings. What has evolved, and I would almost consider it devolved, that an engineering firm that, like a Larson Engineering, if they did a subdivision and they built a plan and showed the lot layouts, and Jeff Larson stamped that lot layout, and this was something that we tried to change in the legislative session, and we couldn't, and had the DEQ directed them to show a representative septic system drawing, even if it was conventional, that would trigger this certification in as-built. But we disagree with that. That costs the consumer approximately $1,500 for certification in as-built to do on something that we do through Title 50. So Title 75 is all of the subdivision stuff. But we have an obligation in Title 50 to permit and ensure that septic systems go in and function and comply with the rule. We do that. We certify that construction, and we do an as-built, and that's put in the record. DEQ has taken something from the Board of Engineering and said it would be a really good idea to see these things certified and have as-bills, and they're enforcing a rule that's not theirs. So this memo was created to make it clear to DEQ what we, Flathead County, will do under Title 50 regarding the requirement of certification in as-bills. And they're specified here because we actually require more systems than the state health, the state DEQ does to require engineering. They only require engineering on wastewater systems that generate over 2,500 gallons a day. We do all of the ones that are specified here. Alternative experimental systems, elevated sand mounds, recirculated sand filters. So we have a list. So we wanted to identify that list to DEQ for subdivision review process is what we will require stamped and signed engineering plans for, and all of the other ones we will not. So this is just basically telling the DEQ what Title 50 obligates us to do. And since Title 50 and Title 75, the subdivision review stuff has to align, we're aligning our regulations with what's needed. And some of this is, as I know Pam would know, we tried to get some of this stuff changed in the legislative session because this detailed need for plans for a conventional system is nonsense because we do it all through our process. And we're basically saying we're not going to deal with nonsense anymore. In a nutshell.
Good question. Do you anticipate any pushback?
Yes, I will.
Are we poking the bear with the deep cut book?
It's not a fair bill.
I know.
It's literally, I think it's a valid comment and question that you make, but realize they're trying to enforce something that's a guidance in the Board of Engineering. They shouldn't be doing that. It's not part of their regulation. This is an overreach by them, not by us.
And it just pertains to the septic systems.
Just
So
because,
it's just limited.
Could we be a Pied Piper in this with the other counties?
I hope so. I hope with all of our consultants too, that it's crazy that they have to carve out a lot of time to do something that we do on a daily basis.
And this memorandum that's going out is been developed based on comments we've received from the engineering. So that's important.
Can you think of any reason we should not support this?
No, I actually think our partnership with the consultants is really strong, and this only helps build a better relationship with them.
Have you motion?
We do need
I move, that we approve. I forgot the name of the document.
It's a memorandum.
Remember,
And one other point, and we had a discussion around this, since Roger actually is a consultant, we felt that the best thing to do would be to authorize me to sign.
may I modify the authorized and directed to sign?
Very good.
I'll be happy with it.
Is there a second to Bill's motion?
I'll second that.
Thank you. It's been moved and seconded to move forward with sending a memorandum to the Montana Department of Environmental Quality regarding certification of septic system plans. With that, any further discussion?
As far as I understand, what we're looking at is some consumer protection to make sure that they're not being charged for or being recommended for duplicate services, and that makes a lot of sense to me. But we're also keeping the environmental standards, which we want to hold up, and I think that that's great. But it makes sense to see what the recommendation is, since it does really affect developers and it does eventually affect the homeowner and consumer. So I appreciate this.
Thank you. With that, Janelle, can we have a roll call vote, please?
Artis,
Aye.
Annie,
Abstain.
Bill,
Aye.
Jessica. Aye. Kyle,
Aye.
Pam.
Aye.
Pete,
Aye.
Roger,
Aye.
Ronnalee. Yes.
Thank you. Okay, like Jill says, we will keep you posted on the response we receive from DEQ. With that, we move on to the revision of the bylaws.
So the variance.
Oh, the variance. Oh.
Wait a minute.
Oh, sorry.
All right.
All right.
Good, thank you. So this is a variance request submitted by Justin and Laura Tilley, who is being represented by Matt Nerdy of A2C Engineering. This is a developed site at the moment, and it has an antiquated system. And there's very shallow groundwater on the site. The system that's in place now, and the owners, full disclosure, the owners came to us because they want to modify their house, and they know our regulations require. Anytime there's a modification, it will impact the sewage treatment system, and the sewage treatment system needs to be upgraded. The system that's in place now is a dry well or two, stacked dry wells, and a little bit of line off of them. And if anyone knows shallow groundwater in dry wells, the sewage is going directly into the groundwater. This was brought to us through, our staff monitored the site. The groundwater is as shallow as 42 inches on the site. Our regulations say that you have to have 48 inches of natural ground surface between the bottom of your drain field and shallow groundwater to issue a permit. And it would be the same now anyway at that point. But our regulations specify that's the limit that the staff can deal to, right? It's 48 inches. At 42 inches, the staff is unable to go forward and issue a permit based on the fact they can't comply with the regulation. And that's why there's a variance in front of you today. The only thing I want to mention is you've read through this. I've looked at a few things around the process, and we had a nice discussion around this at the Environmental Health Committee meeting. Because this is somewhat of it is a modification of how we employ the regulation. This has to be done in a public hearing, which this is a properly noticed public hearing. And if you adopt the variance, if you approve it, then you have to adopt the findings. So when we go through this, I hope you've read the findings. If not, I will read the findings to you, but it's very important for process that you adopt the findings also. But if you just race down, you've seen some of the stuff that I talked about. If you get into Matt's engineering, and if you go to the cross section, that's a good one. Keep going. It's right down there. It's multiple pages. There's the site. It's up east of Whitefish. There's the original permit. This is the replacement plans applicable to the variance, keep going down. If anyone knows this area, it is really shallow groundwater. That's part of it. So next, this is a little bit difficult. You could, if you can turn that. All right. This is the most important cross section that you need to see. And you'll understand that he put, usually there's only 12 inches of sand in a 48-inch design, 48 inches to groundwater. He's put 19 inches of sand under there, which pushes the system out of the ground further to get our 48 inches plus, okay? They've done everything in engineering, design, and control to make sure that our treatment requirements in our regulation are met. And with that, my thoughts are we should move forward with approval. And I believe that Roger, as the chair of the Environmental Health Committee, would concur that we felt that this should be approved.
So the Environmental Health Committee did meet last week, and we reviewed this at that time. Other than that, we can give you our, we won't have to cover this in our report now. So anyway, it's a well-designed system, as Joe said. It goes beyond the standard, so it offers a higher level of protection. And the committee recommended that it move forward. It received unanimous approval to.
Short question, that Artis is on the committee as well,
Yes.
and you both have a lot of experience in this area, so you're speaking as experts.
Right. So as Joe mentioned, it's kind of a procedural thing too. So Janelle, if you can scroll down to those findings of fact. We do need to kind of been brought to our attention. This is similar to the planning board, board of adjustments, whatever it is. We're gonna approve a variance or conditional use permit. The process is to initially approve the findings of fact and then move forward with approval or denial of the variance.
Start with the analysis of section 14.6. That's where the findings start, Roger.
So really, it's section 1 describing it, but we reviewed them and we concur with the engineer's recommendations or findings. So this was the committee's recommendation that these findings be approved. So I need a motion to approve those findings.
So I'll make the motion to accept the staff report, memorandum of variance report as finding of fact and recommend that the board move forward with approval of the variance.
So we need to separate, we actually need two motions.
Motions.
Yeah.
All right, so we'll start with the staff report, finding of fact and recommend. So to accept the staff report. Is that the first motion that you?
Exactly.
Okay.
Thank you, Rick.
I do this on the planning board all the time.
Second.
Thank you. So it's been moved and seconded to accept the findings of fact as provided by the staff review. Could we have a roll call?
Artis,
Yes.
Annie,
Yes.
Bill,
Yes,
Jessica? Yes. Kyle,
Yes.
Pam,
Yes.
Pete?
Yes.
I'm gonna abstain on this, and I want to just say only because I know Matt personally, and I just don't want it to be perceived as any conflict of interest. I would otherwise support it, but I just want to be clear on that. But I will abstain for that reason.
Okay, thank you.
Ronald? Yes.
Okay, it's been a motion to adopt the findings of fact passes. We will then need a motion to approve the variance for this application.
So I'll make the motion that we approve the variance for this application.
Okay, it's been moved and seconded to approve the variance for. Remember the name of.
Justin.
Justin and Laura Tilly. We have a roll call, please.
Artist,
Yes.
Annie,
Yes.
Bill,
Yes,
Jessica,
Yes.
Kyle,
Yes.
Pam,
Yes,
Pete,
Again, I will abstain only because of received conflict of interest.
Roger,
Yes.
Ronald,
Yes.
Okay, thank you. That variance will move forward. So Joe, you can notify the engineer and the applicant. Proceed. Thank you. I guess I was operating off of an old agenda. Anyways, now I'll get back on the way. Now, the next item is the review and consideration of the bylaws for the City County Board of Health. Joe, brief us on that.
So we. Bylaws that are in front of you that I put to you last month, okay, with the interline and underlines change. The bylaws that are clean, and you need to look at those, there's 2 changes on them. And they are based on 257's codification for 50-2116 or House Bill 125. What 257 did is it took out that preamble, section 1, in the powers and duties that states it was the purpose of this chapter. That was taken out. It was taken out and everything was put back the way the original Title 52-116 started. But there was one additional change, and I want you to know that it also took out employ qualified staff, which was probably missed in 121 because we took that away. The health officers employed basically by the county, right? But it still had stated in here that the board would employ qualified staff. Well, we're all county employees. So it was good that House Bill 257 caught that. So I have removed that in the clean version of the bylaws. Everything else is as we discussed. I feel fortunate that I had the thought of starting this process early and not waiting until December, and leave it at that for now.
I had just one place in there that I just want you to take a second look at. And I think you came up with some different verbiage we talked earlier. It's on page 2, number 2A. That language we discussed earlier.
The consideration is there is we don't directly accept funds from anyone. The funds are accepted either via contract or some other obligation, and they're always accepted through the Board of County Commissioners. So I changed that and I put behind part A, with the governing body's approval, accept and spend funds received. That just clarifies that it has to go to the Board of Commissioners. We have our own fund, so we would still accept them, but we would not directly accept them without approval by our governing body, the Board of County Commissioners. So I would add that if you make that motion to add that language.
So I would move to add that language to the section that I referred to.
I'll second that. I guess we're just making an amendment or revision to it.
Just amendment.
Yeah.
good question. Have we had bylaws all along? I was not aware of that.
We have, Bill, some of you have it, some of you may not. Remember the little guidance document that I gave everyone? They're about the second to the last appendix in there. So I tried to keep that up and contemporary, but I don't even know who has got stuff.
Just a question, are there other parts of the county or other municipal bodies that have similar requirements to have bylaws doctrine? Or is it peculiar to the departments, the health departments and Board of Health?
Most organizations they're formed under a resolution. And then per that resolution, the board would come up with the bylaws that mirror the resolution.
Okay.
And I'm glad you brought that up because I wanted to go into that a little more because we did have some public comment on these. The commissioners have been working on the interlocal agreement between the county and the cities for many, many months. And with the new census numbers, it became apparent that Columbia Falls and Whitefish were going to meet the plateau of having enough population that they needed to have by law a Board of Health. So we've had many, many discussions on how that would look, how that would work, what the makeup of the board would be. I mean, we've just been around a lot of moving parts here. And I don't remember just recently, it's been just a couple months ago that the commissioners passed a new interlocal between the county, and it was just with Kalispell, now it's with all three cities. So we need these bylaws to reflect that change that the commissioners did a few months ago through a resolution with the other cities. So what we're working on today is to bring it up to speed, not just with the legislation, but with the interlocal that the commissioners passed. So that's why we're here today. So hopefully that helps a little bit.
Good explain.
Can I make a
Yeah.
comment and ask a question? So the problem last year, in the opinion of a lot of the citizens, I would say the majority of the Flathead, is that the health officer in 2020, and it was your predecessor, took a lot of things onto herself that the citizens objected to. And I remember when she shut down many venues in March of 2020, and it was the people that were running these different things, like the gun show and other things, that contacted me. I never heard about it ahead of time. The health officer, we're the health board, at least at that time, theoretically, that health officer was answerable to us. She shut down these venues. We didn't even know about it. I found out about it from citizens. So that's what happened last year. And I remember well in my interview with Joe, when, 45 minutes or however long we talked, I brought that up. And you said that was wrong the way she did that. Whether you want to admit to it or not, you said that was wrong the way she did that. All right, so that's 2020. And since Joe has come on as the health officer, I have brought up more than once that he's doing things without us even knowing about it. He is sending letters to superintendents, to teachers. That's been going on all this year, to my knowledge. And I've been trying to be very polite and respectful of his position by not bringing very many things up to the board, but after the September meeting, I brought it to Joe after the meeting, not publicly, to say, I'm getting emails from teachers, I'm getting emails from parents. They're sending me the emails that Joe is sending them that we're not even seeing. We're not even seeing them. And I didn't get the ones that Jessica sent, or if I got them, I didn't have time to look at them. But there's a lot going on that we don't even know about that Joe is doing. And he's meeting with the commissioners, you know that, Pam, okay? So, but there's no medical input from doctors or anybody else. They're not asking anything of us. So my biggest problem with these bylaws, where they are, it does not put in there, is there anything in there that talks about who supervises you? Is it the county commissioners? You've been meeting with them every 2 weeks, from what I understand. Nothing that we didn't know about that. I find this out from citizens. And doesn't seem like we should know about these things. These are happening. I should be finding them out from citizens. So there is nothing in here. This leaves the health officer more road than they were before. And a lot of the legislation that was passed that's not included in our bylaws and probably should be incorporated are those bills that were passed specifically to put the controls on the health officers across the state. There are several bills like that. I didn't have time to look them all up, but I can be happy to find them. And so the way that House Bill 121 was lined out, And I understand that people were upset about health boards, but health boards actually serve an important purpose. There's nothing wrong with health boards in and of themselves, just like government. There's nothing wrong with government. Government is God ordained. There's no question in my mind about that. But government is always jurisdictional. And when those portions of government go outside their jurisdiction, there's a problem. And so, that being said, to have somebody that can just do whatever they want, no supervision whatsoever. And what happens with these bylaws and what happened with HB 121 is that health boards were completely removed of any authority whatsoever. Are the only thing that remains, if you look at it that way, and that's why I opposed it. It lists all the things that we can do and things we can't do. And I think if that what I call the Bill of Rights of HB 121 that told boards what they can't do, maybe some people here would object to it. But because in our bylaws, it only includes kind of general things, people don't see what's happening. But we have become like maybe we already functioned as a rubber stamping board by and large, but we've become a rubber stamping board with no ink. We have as much authority or input as the Walmart greeter does to Walmart business. We are totally impotent for anything. The only thing that we could potentially have that's meaningful is some amount of supervision over the health officers. And so the public and the legislators are responding to the horrible things they saw the health boards do, took away our power. Other portions took away the power of or made it, something that had to be better controlled, took away much of what the health officers took advantage of. They removed some things. That has to be included in our bylaws. Otherwise, what is the point of us even being here? What purpose do we serve? Just rubber stamp everything? It serves no purpose. And I know the people that were on the board March of 2020, they know that the health officer at that time, they told us when we started locking down businesses, doing all these unconstitutional things, she told us it doesn't matter if you vote for it or not. You remember that? It doesn't matter if you vote for it or against it. I can do this on my own. And Montana Code Annotated actually allowed that. We all found that out last year. Under the circumstances, the context of the COVID rollout, we found that out. We didn't know that before. And so a lot of the legislation is to put a control on those health officers. And there is nothing in our bylaws that incorporates that. And I think that's wrong. I think there should be an amendment in there that says, who does he answer to when? And what is our this is all make-believe that we have any function. HB 121 took away most of it. These bylaws take away the rest of it. I'm adamantly opposed. I think if we could get this done, that includes an amendment that says who Joe is answerable to, then I think, and it should include us, I would think. We don't employ him. Okay, technically he's employed by the county, but he should still be answerable to us. Otherwise, he's rogue. And that is wrong. And that's what happened in Montana last year. And I talked to you at the end of September. I said, I want to see those emails. Could you please send them to me? The ones that you're sending to superintendents of schools and teachers, please send them to me. You never did. This is what happened. I talked to you personally, face to face, and asked you that, and I never got anything from you. I'm still getting things from citizens, and that's wrong.
Okay, thank you, Dr. Bukacek. I guess I can maybe respond to a couple items, and I think Commissioner Holmquist can lend some advice too. But one is every department head meets with the county commissioners once a month, and it's a scheduled meeting. So, and it's a public meeting, so anybody can come to that meeting when they present their monthly report to the commissioner. That's a public meeting. So for you to say that that's a closed session is totally incorrect.
We have to know about it to be there.
It's put on the agenda. There's a schedule on the internet every week. All you gotta do is look at that. And it's readily available. So you can see what other items are on their agenda also, but that's a consistent thing that happens. So, and it's my understanding that this board is chosen by us, and we're the one that oversees it, and we're the one that is responsible for hiring or firing them or whatever there is. So we
make a recommendation.
I agree, and that's the problem is that we are not getting this information. Where's the supervision when he's sending these out and we don't even know about it? How are we even having any input whatsoever? It should be, I think it should be a requirement. I've been saying that all year.
Well,
He's not answerable to us if he's doing things that we don't even know about.
well, how many decisions does Joe make every day that, I mean, if we have every single one brought before the board, it's gonna hamstring him and his ability to do every single letter he writes, every single quarantine he puts people on for any exposure to bloodborne illness. I mean, we're gonna hamstring his ability to do it. We don't need a babysit.
No, we're here for oversight and not day-to-day interaction, but, like some of these memos that went to school boards, it was my understanding, most of those were saying it's the school board's decision to make how they want to implement their rules, and that's the type of memo that went out. So we don't have control of that. That's the school board that has mandates those things.
Can we clarify that? I received the same claims. Well, have you issued any mandates to any school district?
So the answer is twofold.
Okay,
The first one is I have not directed any school superintendent, or school board. The confusion comes is the orders issuing to isolation and quarantine are mine. I don't sign them, but the health officers' powers and duties as specified in 52-118 specifies that that's my job. And so I have not directed, one of the claims was I directed Whitefish to put masks on kids. Did not do that. Full stop. Didn't happen. They made their own decision. I talked to the superintendent. He asked for input. I said, this is a decision that you and the board are going to have to make. And I left it at that. So those claims are false. And I concur with Pete. I make decisions every day that are based in my authorities in the MCA. And I will continue to make that. They don't they cannot contradict what the Board of Health's powers and duties are. That's actually literally, it's in 118, that I can't do anything that contradicts 116. Can't do it. It doesn't happen.
are you confirmed what my understanding has been?
Commissioner Holmquist,
Yeah.
comment?
Sure. So, yeah, I'll just reiterate what Bill said, because some people think that we're meeting continually with Joe and whatever. We meet with him once a month. It's a scheduled meeting, just like Roger said. And it's on our agenda. You can come anytime, or if there's a grant or a monetary item up, it's on our agenda. So just kind of watch our agenda. It's on there. It will say health department right after it. So if you're interested in coming to any of those, you certainly can. We have them all the time. We meet every week on different items. The school board authority, I got to touch on that again, because we as a health board and Joe as a health officer have no authority over what those schools do. He is mandated by law to present what he finds for information. I don't know where he gets his information. You can ask him, but he's just explained it. And he presents that to the schools. They're welcome to do whatever they want to do. Now, I know maybe some of them are saying, well, we're doing it because Joe told us to. Well, we can't help what the schools are doing. That they're not telling you the truth if they're saying that, because they don't have to follow his guidelines. They can do whatever they want. So if they're saying that, you have a problem with them, not him. The other thing was HB 121 took all of our authority away. You said that. That's not true. The only authority that HB 21 took away was the hiring of the health officer. And the only time we would intervene as commissioners in what the health board is doing is if there is a declared emergency. Then the commissioners would step in if they don't agree with what the health board does and hold a public hearing and possibly rescind whatever the health board did. We have that authority. but it's only under a declared emergency. So we didn't take all your the health board's authority away. You still have a lot of authority to do a lot of things, variances, you name it, food inspection, sanitation, all that stuff is not gonna come to us. We don't want that anyway.
That's for sure. That's for
Do you need
sure.
more description?
Yeah, exactly. So, you know, but they did change it so that you all, when we get a candidate, you all will make a recommendation to the commissioners on the health officer candidate, whichever you may bring forward as a personnel committee and the board. And then it is the final decision of the commissioners. That's what HB 121 did. Yes, ma'am.
On what you said. So, recommended state of emergency, the state of emergency actually will cause all these problems. So I'm certainly not saying everything within the declared an emergency, but that is when all the problems happen with the health officer. And that's when the state was locked down and businesses were closed and churches were closed. So it might only pertain to the state of emergency, but that is what I'm concerned about, is if another one gets called,
Right.
we will have no power,
Right.
basically.
Well, no, you could still exercise your power, but if we don't agree with it as commissioners,
Right.
then we will hold our own public hearing and possibly have the ability to rescind that.
Yeah, quite honestly, if it was just the county commissioners, I'd feel comfortable, but the governing bodies include other things. And
Well, the governing body is the county commissioners,
No,
and that's why
there's
these are so important,
there's
because it specifies in here who the governing body is.
It includes county commissioners, but there's an A, B, and C in there. And the
Well-
C is fairly nebulous.
But we are the majority, and we are the ones in HB 121 that have the authority, not the cities.
You're listed
The cities
first.
are joining only because of the census, only because they've met in a certain population threshold that they need a board of health. And if we were not to allow them on the board of health, they could have their own health board. But guess what? They would get authority over 3-mile radius of their city with that health board. So, you know, what do you want? You know, besides, it would probably cost them a lot of money. I don't know, it would be very expensive for a city to set up their own health board. You know, there's just a lot of reasons. We've been through a lot
Yeah, I know,
of
it's
discussions, as I mentioned earlier. This has been around the block many, many times, many discussions. The cities in the county agree that this is the best option available to us per the law. And I agree with that. I think it's the best option for our citizens, for our community, for everybody. And you know, at first I wasn't, believe me, I was fighting it, but I'm for it.
The other comment that I have as far as these schools don't have to do what Joe tells them, that I haven't read this group of emails, but I did read the ones earlier in the year, and I had commented on them at our board meetings back then. And they were very strong statements about what should be done with masking and vaccines, very strong statements coming from the health officer, which most people probably think we're in agreement with him. And we were not even contacted. I'm getting this from, like I said, teachers, parents concerned. And so they might not have to do what he tells them, but they do. You know, they didn't have to shut down all these events because Hillary Hansen told them to, but they did because they're afraid. And so he made very strong statements. And the ones that I saw earlier in the year, I haven't looked at these, but it's probably the same thing. And people are scared. And so they're following it because he's the ultimate authority. And I don't agree with that. I don't agree with it based on his training. I don't agree that he is. I think we should have more input. So, so the meeting with the county commissioners, so from what I was told from the public, and it sounds like it's not true. So there has been no meeting just with the county commissioners and Joe Russell, and he brings in superintendent. There's been nothing like that. Okay, so that was misinformation that I had.
So we would never do that.
So it's just, okay, well,
Yeah.
so that's one thing that infamous information.
You're
I was
assuming the commissioners like.
getting. Pardon me? I used to too, so, you know, sometimes you find out a little
You
more.
know,
about
and Joe is somewhat not kind of restricted through his job description. He has a job description that he has to follow. And some of that job description is to make recommendations. That's part of his job. And I get what you're saying. You would rather want to see those.
I'd be happy to.
But you
I'll
know,
take the time.
that's something that administratively you could ask him.
I did.
Okay, well, I can't speak to that. That's for you, but
So I'll just add into this one. I mean, I run across this is board management. When it's city council, we have a city manager. It is our sole employee that we manage is the city manager. We're not there to micromanage or to get into the negotiations that the city manager has with the law enforcement or with the fire department. We hire a professional. It is our job to make sure that we've hired a professional and they administrate. And then we're not becoming a bottleneck by bringing that all to the city council. That's the same thing with a health board. It's not our job to micromanage or bring everything into a board meeting for every action taken. The health officer is also spelled out with what their authorities are in Montana code annotated. And that, I believe, historically is what Hillary Hansen was speaking to, is that there are powers and duties that a local health officer is detailed in Montana code. And the legislature cleared that up and actually gave some authority and clarity, which I think was with a lot of debate, but also with the conscious that there was some things that was unclear for law enforcement, for some public officials to understand, or it was 121 gives that clarity for state of emergencies. So what we're doing here is really incorporating the update of 121 and what the legislature did this year and put that into our bylaws. The Montana code also is what says that once you get to being a class 1 or class 2 city, you need to have a health board. And that's what why we worked, and I've been an advocate for making sure that the interlocal agreement did include the other cities, because that is actually what Montana code annotated says. I think we're being we're keeping to the letter of the law there of how this is supposed to work. And when we go down to the powers of authorities, the powers of local health officers, that hasn't been changed by the legislature. That's not what 121 changed, and it is still in Montana code annotated what Joe's authorities are, and that's what we hire for when we go into the job description and making sure that we are hiring a qualified, but also somebody who does have the skills to do that. And we have done that. I do believe that Joe proven that he also has the technical skills and the ability to do the job that he's done, that he's following out his charge. So I think that what we're doing, Annie, is really incorporating that, and this is sort of the board responsibilities that we have. And I support the changes that we're making because they actually do, again, incorporate what the legislative changes were this year. And we've made sure that that's incorporated into the bylaws.
Yeah, it's not everything that Joe does that anybody would want to hear about, but there are major serious consequences when he's recommending quarantining healthy people. I'm sorry, historically we haven't done that, and until last year, I don't think any of us would have even thought about that as medical, care professionals would have thought about quarantining healthy individuals based on contact tracing. Now, I haven't looked at this bunch of emails, but that's my understanding is that based on someone's contact with someone that might have had or tested positive, you're quarantining them. That's my understanding. I haven't seen your emails. So if that is true, and mandating vaccines for children for something that is not life-threatening to these children, and that people should have a choice, parents should have a choice. Those are serious things that Joe's doing, if that's true. So I'm not asking telling people what kind of toilet paper or whatever. I'm talking about serious
I'm gonna stop. We're just gonna stop, and I'm gonna say one thing, and then we're gonna move back on. We segued into this way off our topic. And I'm gonna say one thing. If you have problems with Joe's performance, send them to me in a written format as the chairman of the board, and we'll take them up with the personnel office. And we're gonna move back on to the bylaws that we were talking about. So it is an action item.
I've got a little more on the bylaws, thank you. Go to page 4. Memberships, Article 3. Number 2. Go down to C. It says at least 5 additional members appointed by the county commissioners. And then some was stricken, and it says it was recommended that member Anyway, I'm gonna make it different. So I'm gonna make a motion that it reads like this. At least 5 additional members appointed by the Flathead County Commissioners at their discretion. It is recommended that at least 1 member of the board shall be a medical doctor, nurse practitioner, or physician's assistant. That's it.
You'd like to reintroduce the physician, the medical
I do.
professional
I think we
language
need
back
at
in.
least 1 doctor. I think that's very important that that's spelled out as we go forward, as we have different commissioners possibly on board or whatever. I think it's good to have 1 medical professional on the board. And I think it's good to have that.
Would you repeat this, raise the medical doctors?
It is a medical doctor, nurse practitioner, or physician's assistant. Is what we had before. It's what was there before.
So exactly what was there.
Exactly what was there before.
That's Susan.
We took out, these additional members are to represent population centers in the county that are not entitled to representation by statute. You know, that I guess could stay too. It really doesn't matter. It doesn't. Either way on that one. I don't know that it matters, because it's at our discretion anyway, what is on there. But I do want to leave in the medical doctor, nurse practitioner. So let me reread my motion. Does anyone want to keep in the additional members are to represent population centers in the county that are entitled to representation by statute? Does anybody like that or dislike
I
that?
don't like it. How do they feel?
Okay.
And I think that at the discretion
At the
covers
discretion.
them.
And well, I mean, and the fact that this was here, I mean, that was there previously before we had the interlocal of adding in Whitefish and Columbus Falls now, right? And so now that we have those in by interlocal agreement, I think that part is
Perfect.
less relevant.
I agree. Okay, so I'm going to read my motion again. I move to change under Article 3 membership, number 2, Part C, to read as follows. At least 5 additional members appointed by the Flathead County Commissioners at their discretion. It is recommended that at least 1 member of the board shall be a medical doctor, nurse practitioner, or physician's assistant.
Thank you. Is there a second?
Second amendment.
Second amendment?
Are we gonna vote or do we dissolve it?
I think.
Voted on the last one.
Yeah, we
Yeah,
should, this way we
okay.
don't have to segregate anything. We should
So we have to
vote
vote on each amendment. don't we?
on each amendment, yes, sir.
Thank you. All right. So did we vote? We didn't vote on the first amendment yet.
Yes,
Okay.
Yeah.
All right. So we have another amendment in front of us and just upfront stated it. We have a roll. Oh, it's been moved and seconded. Could we have any further discussion on it? Okay, could we have a roll call vote? please?
Artist,
Yes.
Annie,
Yes.
Bill,
Yes,
Jessica. Yes. Kyle,
Yes.
Pam,
Yes.
Pete,
Yes.
Roger,
Yes.
Ronaldine.
Yes.
Okay, thank you. All right, with that, are there any other?
Okay, this is just more of explanation than a change, and maybe I'll have Joe kind of chime in here. Under the same Article 3, number 1 is actually language out of the MCA or Title 50, Chapter 2, 106. And item C talks about additional members appointed by the county commissioners, governing body or bodies of the city or cities participating in the city county board as mutually agreed upon to serve at the pleasure of the appointing commissioners of the governing body. The board shall be composed of at least 5 persons. So at first I was a little confused on that, but that's just out of statute. But that section then is more defined in what I just changed, and I just wanted that on record, because there was some confusion around that I heard from people on that. So just a statement, not a. That was it.
Thank you.
And that's actually supported in section 1, article 3, because it basically states it out of this MCA. They have to, that's the minimum. they have to do.
Right.
Roger, may I make a motion for another amendment to whatever language it was that you used that said your understanding is that Joe, the health officer is under our supervision, you made a statement like, whatever your language was, I think there should be an amendment. This is very nebulous.
What's your motion?
Well, I don't remember what your language was. Was it he's answerable to us, or what was your language? Under our supervision.
I think bylaws. I think much of what Joe does is governed by his job description, not by our procedural documents. This is a procedural document. This is more of this is how we're going to proceed. This is how we're going to do things. His job description is more, this is what you have authority over. This is what you can do. And in his job description, it talks about him being a health officer, sharing pertinent health information. I don't recommend all the language. It's 4 or 5 pages long. That's where he derives his job, what he does, not really in bylaws. So I was just wondering what your motion was, because it may be covered under his job description or in MCA, because MCA gives him a lot of his authority also.
Well, he has the authority to quarantine, but he's recommended quarantine for health.
Recommended quarantine is something you have to do by law, right? It's a state mandated.
It's part of.
Yeah.
We're not
He has to
quarantining
do it.
healthy people. That's
Yeah,
something new last year.
Yeah, it's
Let's go on the record.
okay.
You isolate sick people and you quarantine exposed people. Whether or not they're sick does not matter. A case is someone who has disease, and if the case exposes any one of us, with specific diseases, COVID-19 included, you must quarantine for a specific period of time so you don't become ill, a case, and infect others. This is an age-old public health principle. You isolate sick, you quarantine exposed. That is, anyone want to contest that? I've been doing this for 35 years.
Is it a tradition, or is it somewhere in the law, or is it a
It's
tradition?
in the law.
May I just
It's
say
in the
that
law.
this isn't new. Tuberculosis, how long have we had tuberculosis? We have been quarantining asymptomatic people for a long time. And so I know that Dr. Manning doesn't like some of the decisions that Joe has made, and that is very clear. But this is not something new in his authority to quarantine asymptomatic individuals. This is something that has been going on for a long time, and it just speaks to the political nature, obviously, of the current pandemic. But there are many other viral or bacterial transmitted illnesses where people have to be quarantined before they become symptomatic. And so let's not lose sight of that.
So we have 2 amendments to bylaws. Are there any other comments or further discussion regarding these?
I would like to add 2 of things. This document is primarily for us as a Board of Health. We look at the very top, city, county, Board of Health. Your issue, I think, should be addressed in Joe's job description. We have one for the new Board of Health, which is based on the current job description, which is based on when Joe was the Board of Health a couple years ago, as modified by circumstance. The Personnel Committee can modify that today, tomorrow, just worry about, I don't want to steal Cal's thunder, but it would be appropriate to put it in there if it's a relevant issue that you care about, and I assume that you do. That's where it should go.
Thank you.
So on the bylaws, there's a couple of typos. If it is okay, can I just direct those typos directly to Joe, because it's nothing that changes structure or amends.
Yeah, good observation. I saw that too. So you want to do that directly? That would be
I
wonderful.
certainly will.
So now we need a motion to accept the bylaws, the revised bylaws as amended.
I'll make the motion to accept the amended bylaws.
Make
Second.
appropriate correction and correction and stuff.
Is there a second to Rob?
I seconded that. Bill can second.
It's been moved and seconded to accept the amended bylaws. Janelle, would you please have a roll call vote?
Artis,
Yes.
Annie,
No.
Bill,
Yes.
Jessica,
Yes.
Kyle,
Yes.
Pam,
Yes.
Pete,
Yes.
Roger,
Yes.
Ronald.
Yes.
Thank you. All right, we'll pass that. We are now on to, I'll check both of my schedules here. Committee reports. The first one is the personnel committee. I'm anxious to hear this.
All right, thank you all. So personnel committee, I mean, our update is, so last time we did revisit and approve the job description. And we did a salary adjustment to that. That required us to do a posting of that new salary and that job description. When we received, honestly, we received two applications. The committee met and has decided that that was not a large enough pool, or the applicants didn't actually meet some of the requirements of just so listed out in the job description. So our recommendation is to go forward with something that we talked about before, which is to extend Joe Russell's contract for another 6 months, or actually until June 30th of 2022. That would just concur with when the fiscal year ends. And moving forward with that job description and new salary range with that extension. And then our further recommendation will be that we, in the new year, bring in a firm, a headhunter, and that we would start a new search. By bringing in a firm, what we're doing there is also engaging a national search. We have not actually engaged in a national search since we did it over the summer, but we think that that would be our recommendation. So that's where we are, is that we sort of going back to that first recommendation of extend Joe's contract for an additional 6 months. And then we'll start to vet and look at a new headhunting firm so that we could start a new search in the new year.
Would the next step then be to approve the hiring of a recruiter to that job then? Because would that be a further discussion to bring back to the board?
Yes, I mean, what we would do then,
as to who we would hire.
what we would do then is, yes, we will work with Tammy from HR just to make sure that we look at that. The personnel committee would actually look at the vetting. She's going to look at the firm that we have used to see if there's other firms that we might want to do. So we would probably end up putting out an RFP. We would recommend that, bring that back to the board for approval. And honestly, we probably would, at that time, we would have some new seated members. We'd probably go through the whole new process of a headhunter would have conversations with board members, and we would start a new search.
If I recall, we had 3 groups that we looked at to hire for last time. And so we would basically go through that again.
We would look at what the firms were and what the proposals were.
Well, unless we can negotiate and be comfortable with the firm we have.
Well, that was
would
kind of,
give us a cut rate.
that's kind of where I was kind of segging into that idea. I mean, it seemed like we had a good pool of applicants in that initial go round, and we had a binder full of folks, and unfortunately we couldn't get any of them across the finish line. But I wonder, and somebody who already knows the area and knows what we're looking for, is there any way to kind of be able to kind of be more efficient in that, if you feel comfortable moving forward with that group again?
He's still somewhat on the hook. We'll see.
I mean, we did an extension, we did like a 6 months extension.
To do an extension again.
So just to help everybody through that process, again, we've hired CHS personnel, they did the first search, which was incomplete. They gave us an extension to do a second search. We feel that it's right to give them a chance to see if they want to extend to a third one, or if there would be a new contract that we need to engage. While doing that, Tammy is also looking to see what other firms might be there, so that we are considering which hiring firm we are engaging. Personnel committee will come back with a recommendation of what that hiring firm is, and then start a new process, like I say, in the new year, where we think that that's going to be a more favorable time to be doing a search. Just that, and it's honestly fourth quarter is not the best time to be doing searches traditionally in HR. You always want to go to the first quarter of the year, would be probably better than juggling around the holidays.
Okay, thank you, Pat. Appreciate your guys' efforts on this.
Thank you.
On to the environmental committee report. I guess I can do that. We talked about a couple of things already in the board meeting. One was the variance, and that was approved. The other one was the memorandum to the Department of Environmental Quality. The other two topics during our discussion is, one is we're looking at some revisions to the regulations. The staff had worked over 2 years on those revisions or their review, and Kate Cassidy presented an initial cut to us at our meeting last week, and we had some comments, and she's going to come back with another version. So we're working on it, and next year we hope to bring forward that to move forward with the process of rule revisions. And there was only one other item on that we talked about, was there going to be 2 more variances coming up next time, so stand by. Finally, I guess I have a question, general. We have our biosolids request for qualifications out. I was wondering if you had any, it's always, everybody, all consultants, I know this, personally, wait till the last minute, 11.5 hours to submit. So if you haven't got any, I'm not surprised, but what, have you got many inquiries?
4. And some of them may not pan out, but one of them came in with the secret agent coat on and asked me to sign a non-disclosure agreement, and I said, no. You're dealing with public entity. You go ahead and get your statement of qualifications together. You better apply to sign an NDA. I just not something's wrong. So, and we've had a couple billing firms that contacted us, and some that have kind of dabbled in this a little bit. I got actually have some that have come forward, and I think they're with this that would love us to get moving and get this in place and possibly run it for the county private entities. I'm really looking forward to maybe a private partnership to do this. So it's been a good process. We'll see how it all goes. We'll know in 24.
I guess we'll be passing that.
We'll probably want to be the next week.
The review on this. Okay. All right, we'll on to departmental reports. First one is Kurt. You're all prepared, I see. Always.
Good afternoon. This is the report for October, month of October. General fund, as you can see when you read the report, we've got about $836,000, so good shape. So we're looking pretty good in the general fund compared to where we were last year with about $622,000. And of course, we're going to collect the tax revenue this month for the first installment on taxes. So that'll give another boost to the general fund. Environmental health revenues up 24% over last year, just cooking along. So capital improvements, animal shelter, of course, is working on their building. That's started out.
progressing for the AC chiller for the Rural Bennett building. That contract is either finalized or close to being finalized. So once that's done, we'll have that come in. There's about a 6-month lead on that, and that'll get installed probably in the spring sometime. Home health, negative cash balance of about 33,000, so down a little bit since September. AR balance is about 320,000, and the cash and net accounts receivable about 254,000 in assets. So a little bit of a negative situation there, but Cheryl and Chris are working hard to collect all AR out there that they can. I had Chris go through accounts receivable and look at all those claims individually, and so they look pretty solid for what the AR is. They did mention that CMS, which is the clearinghouse for Medicare, is short-staffed and is behind in making payments, and that's also a reason for cash flow not quite coming in the way it should, but we want to keep an eye on it over the next several months.
My understanding is that there was some negotiations going on versus for reimbursement rate. I mean, is that something that you see, or does that need to go through Cheryl?
That Cheryl works with.
Yeah, but you have not seen any difference as far as reimbursement rate.
She's actually negotiated a couple of changes in rates, and one of them's Medicare. So things are looking better on the collective side.
And of course, one thing that will help us out going forward, the immunization grant received, there was an amendment that was approved for 951,000. So those dollars will take care of our COVID expenses going forward, and there'll be the general fund will be relieved of some of those expenses and move to the immunization grant. So general funds are pretty good. So.
Where does that grant come from, the state or?
It comes from the state, yes, but the funding, obviously, from the funds. Any questions?
How much money fully came from COVID related or the COVID cash from state and federal to the health department? You might have shared that with us before. I just know that with home health, there was 170,000. I think there was some others. So them being negative 33,000, that's with getting a whole bunch of money from the government, tens of thousands of dollars. And so I'm just wondering with the health department, how much money have we gotten from the
Off
state?
the top of my head, I don't know what the breakdown was. There were some that came from the state, some came from the feds. I do know previously, probably the previous year, probably $611,000 that came from the feds for COVID, but I would have to take a look. Yeah.
That'd be great. Thank you.
You bet.
I'm just thinking that's almost a million at 951,000. So, and that's now. So I think the total must be millions.
It was for total funding, I think I shared with the board, it was a couple $1 million for the previous year, but that was encompassed all revenue
Oh, that's
sources.
it.
So,
Yeah, if I took the total, that'd be great.
yeah, you bet.
Thank you.
Well, and just to clarify, we took this and had a nice deliberative discussion with the commissioners on receiving this money. This money is almost unencumbered, so we can use it for all COVID, even though it came through the immunization program. We can use it for contact tracers and other things. And Kirk and I kind of back of the envelope, we spend about right now 16 to 18,000 a week on COVID related expenses. And if you start to do the math, that money will cover it, but it won't over cover it by much.
It's one of the reasons I was asking, is just looking at home health, that's why it's only 33,000 in debt. I'm just wondering with the money that we got, how much of that money that we got explains why we're doing well. You know, what's the net? If you just send that to me later.
Explain it to me again.
Well, as with home health, you know, they have a negative 33,000, but they got, I don't know, over 100,000, I think, from state and federal. That's my understanding from our meeting. And so the general budget is doing pretty well. We're doing well as a health department. And I'm just wondering what the net is, how much we got from state and federal related to COVID.
Concerning
Yeah.
anything?
Yeah. We just talked later.
Yeah, well, I can probably speak to a little bit of that. Right now, we've had about 250,000 in COVID-related expenses in the general fund. But of course, as Joe mentioned, that each month we're going through a certain amount of expenses for COVID, and those expenses will be moved to that immunization grant. So right about now, it's about $250,000 so far. And so as you mentioned, that like you say, close to $1 million, but it will get wound down by the end of the year. And so once those expenses are relieved from the general fund, there won't be any COVID expenses left in the general fund. So,
I'll
answer
talk
your
later.
question.
That's okay. I don't want to.
Okay,
I didn't-
okay.
didn't want to.
Yeah.
Thank you.
Thank you very
Any
much.
further questions?
Very awesome. Thank you.
Okay, we'll move on to community.
So I brought our newest nurse, Janelle, to say hi and introduce herself to you guys. I'm gonna let her do that real fast. She's working immunizations today, so I want her to get back downstairs.
Hi, I'm Janelle Aubert. I was born in Kalispell. I grew up on the other side of the mountains and I've been living here for almost 3 years now. And I just started here as a public health nurse. It's completely different than what I'm used to. I'm used to more skilled nursing, so it's interesting and great, and I'm really happy to be here.
Welcome.
Thank you.
Welcome.
I appreciate it.
Okay. Couple things. So Janelle is one of our MCH nurses. So with MCH every year, we pick this big annual project that has a couple activities, and we incorporate it together with FICMR, our fetal, infant, child, maternal mortality review team. And this year we're doing a safe sleep initiative. So we just started this in October, and it will go for the whole year. And I brought one of our activities to kind of show you guys of what our safe sleep initiative is. So part of our FICMR portion, we're partnering with Logan Health Labor and Delivery to deliver these safe sleep education and resource packets. So they're pretty cute. I do say so myself. They have our introduction of why we pick safe sleep. Safe sleep is one of the leading causes of infant death in Flathead County, so we thought it was a great topic to try to, reinvigorate some public health and kind of get it away from COVID focused stuff. So we're focusing on safe sleep. It has a brief survey just about safe sleep practices that they fill out after they do our little education spiel. And it has some safe sleep environment handout, something to hang on your door. There's another quick resource that's just some pictures of some safe sleep practices. And then in every resource kit, there's a safe sleep sack, which is, as you guys probably are aware, is one of our safe sleep practices. So our intentions with this project for FICMR is to give one of these to every baby delivered at Logan Health over the next year. So we're anticipating giving out about 650 to 700. So pretty exciting, pretty fun. Our home visiting program and our WIC program will be incorporated into the Safe Sleep Initiative as well, with kind of a different version of a resource packet. And then also some safe sleep demos with pack and plays and bassinets that we got money to provide to families who don't have a safe sleep approved service. So we're partnering with Healthy Mothers, Healthy Babies to do that portion, but something fun, yeah.
Coming from Logan Health, I know that safe sleep is very much stressed, and I appreciate your efforts. There are some births that are happening outside of Logan Health, and some lay midwives in the community and things like that. Are you also reaching out to them
Yes,
as far
to
as
those birthing
education
centers,
as well?
Yep, we are gonna work with a couple of the midwifery and birthing centers to get them some packets as well. And then we are also working to help out Logan Health Whitefish. They are part of the Halo Sleep Stack program already, so they do get these kind of resource packets that are from Halo, but they reached out and said that they would be happy to do our packets as well. So yeah, kind of fun, something different. So that's our big project that we're working on. I have made 150 of these packets today to pass them out. We're gonna try to do them in quarterly shifts. So we're gonna pass out, 200 packets and then reconvene with our labor and delivery, our team, and then the labor and delivery to get statistics and see how many families we're getting these to and stuff like that every quarter. I'll report back on how that's going. Our numbers, as you can kind of see, are pretty steady. We haven't finalized our flu count yet, but like you guys are aware, we did over 1,300. I think it was 1,308 so far. That is exact on our count. WIC number is very steady once again. We do have a dietetic intern with us last week and this week, and they're working on an outreach project with Head Start, which Head Start is a population that are eligible for WIC, so that's one of our big focuses is to try to get all those Head Start kids on our WIC program. And then we get 2 more interns throughout the year, so we get a total of 3 dietetic interns from MSU. And our next ones are in January and February, and our outreach project for that will be something with the food banks. So we're already working on those projects. Our home visiting caseload is above 100%. We've had a lot of staff changes with our home visiting team, with another position becoming open at the end of this week. So we have 2 home visitors who are trying to keep all 65 of our families on our caseload right now active. So it'll be pretty tough until we're able to hire these 3 positions that we have. So one's a social worker, one's a nurse, and then one is through our partnership with Head Start. So lots of stuff going on there. And then lastly, for maternal child health, we did wrap up our Montana Moms grant that we had. It was a mini grant that provided scholarships for 11 individuals in the community to complete perinatal mental health training. So I don't know how many of those individuals have taken their exams to become certified in perinatal mental health. That's on my agenda to follow up with this next month, but 11 is pretty good numbers. And most of those people are involved in the Maternal Mental Health Coalition. Questions? No?
Thanks.
Thank you.
Hello, how you guys doing?
I'll
talk about it. Anybody have any questions about communicable disease or population health stuff? Just a staffing update, Sarah Pacheco, who was our communicable disease nurse, she was accepted into nurse practitioner school. So she's going back to school, so she'll be leaving us, unfortunately. She was phenomenal, but we have Marissa filling in for her, and she's been being trained the past 2 weeks to help out, and then in the interim with that. With car seat safety, Wendy Olson has been working pretty closely with Logan Health Children's area, and they are getting in one of the gals that's the head up there is trying to get more car seat technicians up there so that they'll be able to do car seat checks up there. And then we're working with Gospel Fire, and they're going to be getting more of their people trained hopefully in the next few months in car seat technician as well. So we'll have a few more fitting stations that people can access a little bit more readily.
Thank you.
Thank you very much.
And I there are 4 people on the committee, 3 of us are retired from this morning. So we may need job. So maybe you're not even thinking.
Oh. Okay, maybe you can bring that with under board member comments. So health officer report, what do you got for us?
Yeah, just, I'm gonna rip through this.
Yeah.
Our first slide is new cases out of the incidence of disease. I get this question a lot, but a year ago, with no Delta, we had higher incidence of disease than we're doing now. With the virulence that Delta is exhibiting, it's quite amazing that, you know, some of the precautions through that vaccination seem to be working. And if you look at prevalence, the next plate, this is actually the same as stating how many active cases do we have at any given time. We continue to see some reduction in our active cases. That's a good sign. We hope it stays that way. A lot of the places around the country are seeing an uptick, but there's a lot of variables that go into that, and clearly not enough time to discuss it. But for those epidemiology wonks out there, that pattern that we see above and down is human to human transmission. That is like classic human to human transmission. Just you probably remember that. Total test versus positivity rate. Once we're moving in the right direction, this is not updated for the last information I received 2 days ago, but our positivity rate is about 15 now. It's been hovering around 20 and plus. So another good sign. I think that some of this might have to do with 53% of our population has at least one dose of vaccine in them. Very concerning to me, though. You know, go down to the breakthrough cases. If you look at next slide now. If you look at breakthrough cases, this is rather alarming. You know, 1 in 4, almost 1 in 4 of our cases are breakthrough cases. Remember back, I told you that in June, our July average was 1.25% of all of our cases were breakthrough. Now 1 in 4. This just shows you how virulent this Delta variant is. So stay tuned. Hopefully things will go well. Did show you the next one down there, the weekly vaccination administration really shows you we have a lot of people that want boosters. I think you know, we're operating at the fairgrounds on Tuesdays. We're doing everything through a scheduling platform now. Our schedule is packed. It was mentioned what's going on next week because of the holiday. We're very short on staff, and so we kind of have to make our immunization clinic a little smaller next week because of the holiday. But we'll probably be busting up the seam the week after that.
What's the day this year?
Tuesdays. Yeah. Show a little bit about vaccination by organization. This is a new plate. See, our mass vaccination clinic really is a really good delivery mode. And Pete would understand that, you know, when you're seeing patients at a clinic setting and you're doing vaccinations, you have a lot of nodes of vaccine. And I thought Logan's numbers over 1,500 is pretty outstanding. We did that over that in 4 days. It's just the way it works in a mass. That's why we do mass vaccination, right?
Mhm.
It just shows you how effective it can be. The hospital census seems to have ticked down a little bit. I'm still really concerned. It's a real stressor on Logan. And I do have some information. The lady that spoke earlier, and she wanted to know of all the people in the hospital, how many were vaccinated. Well, there's 38 folks in Logan today. 6 of them are vaccinated. It just tells you that. I mean, I could get into the data a little deeper, but I need to be careful and cognizant about HIPAA rules, privacy rule. But, you know, the preponderance of people that are having bad outcomes are still unvaccinated. And it does show with the hospital data. If I could, one of the things that I've asked Lisa to do for me is I want to try to give you some more, some mortality data that, you know, really doesn't disclose anything, just so you can see case fatality rates in Flathead County. Now, a lot of people in other parts of the county would say Flathead County's case fatality rates are higher than other places. Well, we also have a significant elderly population here. We should consider that. Don't compare us. We compare numbers wise to Gallatin County, but the demographics is totally different. So don't be careful about making generalized comparisons to other counties. But that's just in a nutshell. I wanted to talk about. David Randall did issue file charges against Pete's Chicken. And the other stuff has all been dealt with in board action. The only reason I put it in here is a lot of folks back in the day would jump to the health officer's report to see a full synopsis of what I do. So that's why I had that. I do the only day or the only week this whole year that I didn't block out, or I blocked out my schedule for an LSU. The only week I didn't, they assigned me to go to Missouri to teach two managing emergency courses. So I'll be on that. Questions to me?
Now, the CDC came out with that report July 30th on the Massachusetts outbreak, they called it, and 74% of those people that in the outbreak, that were involved in the outbreak, 74% of them were fully vaccinated. That was a report from the CDC. And our numbers are opposite. You know, so I'm wondering, do you know why that might be?
You know, Andy, I've read that article. It just appeared to be a cohort that just had a really significant transmission. It wasn't a generalized population. It was a cohort of people that did. I tell people all the time, you get in the perfect setting where you have a lot of, you have a high viral load in a group of people, that it's very likely that you're going to have breakthrough cases. We see it here too. There's something else that's going on that's very alarming to me. I talk to a lot of people that are breakthrough cases, and I say, let's sit down and talk about breaking out this. And they will look at me with the biggest blank stare and say, I have no clue. I wasn't in a group setting. I didn't do anything differently. I think we're starting to see a lot of online transmission that we didn't see earlier. That's just the world according to Joe. It's not science. But I think we're seeing a lot of online transmission that we otherwise didn't see earlier on in this. And I think it's because of the load and just the droplets, the droplets spread through phone line.
Yeah, in my experience, it seems the transmission seems to be fairly random. You know, there'll be a caregiver taking care of somebody very sick in their face, feeding them, coughing on them, they don't get sick. Some people, the whole family will get sick with a viral syndrome. Other people, one person gets sick, nobody else does. Sometimes it's the healthiest one in the family that gets it. So it seems like the transmission is random, which is not normal for any infectious disease, but.
And that's that.
Yeah, we can come up with theories of, but yeah, I got you. So you're thinking about that too. I appreciate that. So that's kind of opposite. The other thing is, in terms of making the conclusion that the cases are down because of vaccines, that's not taking into consideration of the confounding variables. So I think you know enough about, a statistical analysis to know that. And the other thing that troubles a lot of people is that the large breakthrough, okay, that was in Massachusetts, but still there are a lot of breakthrough cases, and I'm seeing a lot of breakthrough cases. And I would say the patients that I sent to the hospital that were sick enough to go to the hospital because of hypoxemia or for whatever reason, about half of them are fully vaccinated, half not in my patient population. So I go by what I know. And so I'm seeing a lot of breakthrough, a lot. And people that get the vaccine a week later are sick. So there's a lot of that, we gotta be honest. And so my concern is not that so much as the vaccines are still covering the so-called, what I would call the alpha variant. They're not covering the delta variant. So people are getting these vaccines, even though we know, there's a huge number of people that get it. And, what the theory is that they would have been sicker if they hadn't had the vaccine. I get it. I hear that. That's what the health department tells my patients when they call. I get that. But where's the proof? There's no proof of that. And some of these people are getting really sick and they've been vaccinated, they test COVID positive. This is my clinical experience, so I believe mainly, I believe more what I see in front of me than what, somebody tells me. So anyway, it's just, we are vaccinating for the Alpha variant, not the Delta variant, correct, including the boosters?
Yes, so the science would say that the Delta variant acts a little differently than the other ones. The S protein chemical nature, the amino acid sequences didn't change a lot, but how it configures itself, it seems to be more sticky. Remember the H1N1 sticky. It seems to be more sticky, and that's why we seem to have more breakthrough cases. The data from the hospital, I will try to figure out a way to show you what is going on in the hospitals related to this, but 6 out of 38 is not 25%, right?
Right.
So people that are more sick seek medical care. So you're going to actually see people that are more sick than maybe the mildly symptomatic people in the community. So a physician is automatically going to see more the sicker people than the non-sick, right? They come to seek care from you. But the data would tell you that even though the breakthrough, my data that I do every day shows you that we're approaching 25% breakthrough cases in Flathead County. But that's not the same thing we're seeing in the hospital. The morbidity is not as high in the breakthrough cases. And I can show you the trends. The study, it's all there. You can see it just based on rates of hospitalization. So
but the narrative is that the people that are getting really sick, it's the Delta variant, and the vaccines don't treat that, or they're not doing a very good job on it, right? I mean, that's the
but
way.
that's the variance of the architecture of the virus that's changed from the alpha to the delta.
Theoretically, but we're still giving the vaccine for the Alpha.
But you're still seeing a reduction in morbidity associated with it. You're not seeing it because your patients are sick and they're coming to see you. I'm seeing it I look at the population generally, and I can still tell you for a fact that the folks that we're seeing less breakthrough cases hospitalized than we're seeing in the general population.
And I can absolutely echo that. I mean, and that goes all the way up from to whether or not you're intubated, whether or not you're in the ICU. If you are not vaccinated, you have a way higher chance of having a serious complication from COVID pneumonia, being hospitalized in the ICU, intubated, or death. The rates of vaccination fall and decrease that markedly, regardless of the variant. And we stop testing the variants because it's pretty much all Delta variant now, but the protection still is there in the reduction of serious disease. And having spent the weekend in the ICU taking care of those patients, I can verify that.
And Roger, last thing, just associated with testing. We just received about 1,000 at-home test kits. They're free. We have them in the building. Other divisions, based on the day, we're going to show on the floor which are getting them. One of the things that I will say, without looking up at anyone if you feel symptomatic, test, because monoclonal antibodies will reduce the morbidity of disease. It is an absolute fact. Pfizer's new treatment is another thing you've got to detect. It's just like flu. The antivirals work for flu only when you detect early and start the dose of treatment. So please keep that in mind. We just put out a press release that we have them and they're free to the community. We have so many people coming in for those kits, and it's a great community service we can provide. And it also tells you one thing: test if you're symptomatic and get monoclonal antibodies early because they could save your life.
Thank you. With that, I think we're running really late today, and so I'm going to move on to, we had certainly questions about department reports already, so we'll just move on to the board member comments. Kyle, we'll start.
Just a quick comment. At the end of last meeting, we talked about having a behavioral health, looking at having a behavioral health committee. Ronald Lee, Jessica and I have met with some community members. I think that there is a need to have a committee that's giving some oversight. What I think that we're seeing is the committee could help us reestablish the conversations that we sort of dropped off in 2019 before we got into COVID. There were some reports there about what we should be doing to create a behavioral health system here in the Flathead. There's also some reestablishment of funding, specifically like the suicide prevention funding that we should be able to prioritize. Then we've also just, in those conversations with community members, there's a need to have access to providers. And I think that that's something that we could, if we were able to focus a work group to be able to talk about how would we, through partnerships, be able to increase access to mental health providers in the community. And then finally, I think that there's just a desire and a need in the community to get back to some of the community conversations that we had about behavioral health, which now includes suicide, but also a pretty large spectrum there. So if it is okay, I would say that the work groups continues to meet and that we could come back and maybe propose a charter for a committee at our next meeting. That is okay with the rest of the board.
Do we have departments that handle this type of stuff?
That integrated
Behavioral health, and I know we have some mental health.
and that's part of the whole.
Yeah.
We call it behavioral health, mental health and substance abuse typically. So yes, we do.
We do have already the system set up. This is just,
Yeah.
what's this then? What is it, community outreach, or why are we setting up a committee when we already do it?
Well, I think that I think it's a little too early for me to say. I'd love to sit down with you and talk to you about this because I think a lot of what Kyle is proposing, the commissioners could benefit from because of some of the stuff that you manage. Behavioral health money.
Yes.
We like to manage it for you.
Pam, originally, this was a motion that was sort of an idea that was brought up by Ronald Lee at the last meeting, of just how to provide some staff support and also just that convening space, not necessarily to enlarge the department, but be able to give that guidance, but also to help bring those community partners in. Sure. That we'd have that as a space. Going back to in 2019, there was a community meeting that was able to, we used some Montana Healthcare Foundation money to be able to have that type of meeting, be able to help guide Jeremy and generally for that. But I'd bring back a proposal next committee meeting.
Dr. Hayward.
Yep, so just going back to highlight the other exciting piece of news in that pediatric vaccines are coming online. And so just making sure that that's fully aware and out in the public. I know several of the public comments were directed at an eagerness to return to a sense of normalcy. So I'm sure all of those parents will be excited to find out that they can now have their kids vaccinated. And that is a large step to returning to normalcy for our families. I know I look forward to getting my kids vaccinated so they can have the same protections that I've had for the past year. So I'm sure the families that express public comments will be eager to hear that.
Two things. One, regarding the behavior health committee, I also, I'm really interested in being a part of it if it does go forward, is also just have that public conversation. Like I think we've gotten a lot of public comments for the last couple of weeks regarding the suicidality of our teenage population. And I think it's good for the public to know that we are thinking about it and trying our best to help. And I'm trying to come up with new funding sources or reestablish funding sources to help in any way that we can. And then secondly, just once again, I just really want to say that as being part of the personnel committee, we've gone through lots and lots of applications. We spent hours looking at applications. And once again, this last failed application kind of pool has just confirmed for me at least, and I think for all of us in this room, that we're super lucky that we had, Health Officer Russell come out of retirement to fill this huge gap. And I think every meeting his input really guides us and makes like a very valuable contribution to not only our community, but the decisions that we make as a board. So I just want to say thank you for your service.
4 members that are gonna be, their term expires on the December 31. So, one, I guess, I really value everybody's input and hope you do. That's my comment.
I have two issues. Some months ago, you and I and Cal went to the Packer thing. I think the sheriff was speaking at that time. And at that time, I recommended the guy that runs the organization that we invite the health officer.
Okay.
And that happened a couple months ago, and about 3 weeks ago, 2 or 3 weeks ago, he was on the podium from the beginning to 10 minutes after the closing. Very well received. People got a lot of information, and I really compliment you to do that, and I encourage you to do it more. Because it was great information to the general public, and I've never seen a meeting allowed to go well over the. I sat next to Ron Lane, I think you had the same reaction. Number 2, this is Simply weekend, Saturday and Sunday. Didn't bring tickets, but I can make up tickets if you'd like to go. It's a world premiere of a cello concerto by Maestro Zoltek, and the cellist is the 6th-year, it's not the right term, but the cellist, the lead cellist of the Los Angeles Symphony Orchestra. Plus a very good show. If you'd like to go, I'm happy to get you some tickets. Or for the department, Joe, if you have a couple of people you'd like, let me know when I'll speak with that. When is this? Saturday? Saturday. Sunday afternoon. And it's very convenient over here at 5 o'clock.
All right, well, I would just like to wish everybody a happy Thanksgiving. Y'all get stuffed and have a great day.
So I'm going to disclose personal information briefly, just because I think it is for the good of our community, that I recently recovered from a really bad case of COVID. And I just want to be public that there's been a lot of conversation about the hospital not treating patients well, community health center not treating patients well. I was treated well. I did have to go to the hospital for treatment. I was treated with utmost respect. All of my desires and my wishes for treatment and how I directed my treatment were honored. And so with the conversation around the hospital's mistreatment of patients, as well as the community health center, I just really want to be public that that was not my experience. It could be other people's experience, but that was not my experience. And so for all of the people who treated me well and respectfully, I'm a good outcome. I'm here today, I'm strong, I'm healthy. I was very, very ill, but I'm happy that we do have opportunities to be treated and to be treated in a way that we want to direct that treatment. And so for that, I'm very thankful for our community health. And again, that's personal information, and I really give it because I think it's really important to know that there are good outcomes and there's good treatment of patients.
Great news. We're glad you're here. Artist.
I don't have any comments.
You don't get artists 3 minutes.
Oh, I know, it's gonna be about a minute, but I think I already said most of what I want to say. So, I've seen many people that were very sick and tested positive for COVID. I've seen many, and almost all of them recover. That's the way it works. And they come back to normal life, and that's the way it works. And so most of them don't employ the hospital. I sent probably 10 people to the hospital. As in 2020, I only sent 1. And so anyway, I've seen lots of people that are very, very sick too, and then recover like you do. So that's an important perspective, I think, that I haven't planned on putting in my comments. But I just want to say again, one last thing. I hate to, beat a dead horse, but when something's severely adversely affecting children, which I think the health officer recommendations to the extent that teachers follow it, with quarantine healthy children. The suicide notes that I'm familiar with have to do with isolation and not being able to see their friends. So we can't separate that. And that's just one aspect of the problem with quarantine healthy children, but that there doesn't even make sense for something that really doesn't seriously adversely affect children. Same with urging vaccinations, which I haven't read the emails, but that's my understanding, is that our health officer is urging vaccination of children for something that we know is not causing severe illness, and we know vaccines are killing children. We know this.
That's not
Myocarditis is happening with children. Oh, no child has died from it. Okay.
Anyway.
Anyway, so that's it.
Appointment, so I have to go.
Thank you. Thank you very much.
Does anybody want to take a